Hello, I'm Dr. John Iskander. Welcome to CDC Beyond the Data. I'm here today with Dr. Indu Ahluwalia, Chief of CDC's Global Tobacco Control Branch. Welcome.
Thank you.
So Dr. Ahluwalia, about 6 years ago, we produced a public health grand rounds about global tobacco control. Can you bring us up to date about, first of all, what is the global burden of disease related to tobacco, and are we making progress in controlling that?
Certainly. We know about 1 billion people in this century will die of tobacco smoking. And of those, about 700,000 per year die from direct tobacco-related tobacco use, and about 600 or 890 die from secondhand tobacco smoke, and these are people who don't smoke themselves. So burden continues to be quite large. And in terms of, when we think about the CDC's role, we are able to help countries make critical decisions, and international organizations use the data that we collect through our surveillance systems to monitor what is going on in terms of both the burden of tobacco use as well as the solutions the countries have undertaken and potential impact of that. A recent report that was released by the World Health Organization indicated that there's certainly progress in terms of globally there's a reduction in tobacco use. And what we find is, within that report, it also had some alarming things, that the rate of decrease among low and middle income countries is slower. So we still have a lot of work to do. And we think that the data that we generate and we help countries to translate into actionable policies and programs are critical to moving the needle forward.
So clearly we have ways then to monitor different aspects of smoking and tobacco globally. Can you tell our audience a little bit about how we monitor everything from smoking to exposure to advertising?
Sure. So the CDC Global Tobacco Program, this is where the Global Tobacco Surveillance System is housed, and we have 3 different components which we are able to work with each country side by side to implement. We have the Global Youth Tobacco Surveillance, which is GYTS, active in 188 countries. It is the largest surveillance system, continues to be so, and it is targeting kids who are 13 to 15 years of age and in schools. We're very proud of our system. And then we have the GATS, which is the Global Adult Tobacco Surveillance, which is active in about 34 countries, and it targets adults 15 years of age or older. And it covers about 70%, or it represents 70% of the world's population and about 75% of the smokers in the world, which is quite remarkable. The third is we have a set of tools called Tobacco Questions for Surveys, which are systematic, standardized set of questions that countries can use and integrate in their ongoing surveillance systems. And with the 3 components, we feel that there is a sustainable way to monitor tobacco globally. And our role is to work with countries to figure out what their needs are, and then we work side by side with countries, ministries of health, ministries of education, even the global partners are at the table. And what we do is we systematically make sure the training is standardized, the data collection is standard, so we can compare the data across time and across countries. And that's an important part of having a surveillance system that contributes to the landscape.
So, and you shared with me earlier some examples of countries that have used that monitoring and surveillance as part of their tobacco control strategies. I wonder if you could maybe just share one of those examples with us now.
So, using the data for tobacco control, I think, otherwise we're just groping in the dark, and countries are very eager to have data. And I will share an example of Uganda. They had first wave of data, and they passed the National Tobacco Control Act in 2015. Prior to that, they were the country who used both GYTS and GATS data quite effectively to rally the troops, so to speak. They used the data to educate and mobilize their stakeholders. So there was support for passing the law. There are other examples of countries that have had multiple waves of data. India comes to mind since they just released their data very recently. And India saw quite a great decline in tobacco from the first survey, which was done in 2009, 2010, and the most recent survey, which was completed in 2016, 2017. And part of that allowed India to know that the law that they passed under their Food Safety Act in 2011 banned gutka, which is a flavored tobacco with areca nut. And the state subsequently in India adapted some of that law and stronger provisions to ban other flavored products that contain tobacco. And what the data really showed for India was that there was a decline in smokeless as well as combustible tobacco products. Because there was fear, of course, that you ban smokeless tobacco and there might be an increase in combustible, and that didn't happen. So what that really demonstrated to India and the states and others watching this very closely is that when a strong legislation is passed, there is an impact, and our data were critical in measuring that impact.
So, yeah, very important, of course. My understanding is Asia is now home to half of the world's smokers, so very important to hear of that substantial progress being made in India. I think a lot of our viewers may wonder about the changing landscape of tobacco products. We have e-cigarettes now, but particularly in low and middle income countries, we also have, people may know them by different names, shishas, hookahs, water pipes, other different kinds of products. What do we know in general about use and control of those types of tobacco products?
Sure. I think you bring up a very important point, in terms of the changing landscape. And what's interesting about the global landscape is that, if you look at the data, what they're showing is there's been an astronomical uptake of vaping products like e-cigarettes and e-pens and all their iterations. So there's a very rapid progression in the global market of these products. I think it's anticipated to be reaching 55 million users by 2021, which is only 3 years away from about a 7 million that was observed in 2011. So a huge increase anticipated by 2021. And what the other interesting thing about the changing landscape is that when you look at the 10 top global markets for sales of these products, of course, the Western countries are there. But what's remarkable to me is that both India and China are among the top 10 purchasers of these electronic products that are available. And one of the things we find with we've been in the forefront in terms of surveillance. Both GYTS and the GATS surveillance have collected some information from a number of countries about whether the kids are aware of the products and what the use is, and for adults as well. And what we find is there's a high level of awareness. When we look, 20%, upwards of 20 to 95% among kids, similarly among adults. It varies by country, of course. And the use is still low, which tells us that it's very possible that as the cost of these products goes down and marketing is very aggressive, as we see, that there is potential for these to increase worldwide.
So certainly something that will need to be monitored going forward.
Absolutely.
So you gave a couple of examples earlier of India and Uganda. Both of those involved laws. There have been a number of types of laws and policies that have been proven to be effective in decreasing tobacco use and harms from tobacco. Could you briefly review what some of those are?
Sure. So most of the countries are signatories to the World Health Organization's Framework Convention on Tobacco Control. And with that comes a set of guidelines that countries can follow and reporting requirements. And in addition to those guidelines, there's the Empower demand reduction measures. in those demand reduction, these are proven strategies that countries can adapt for their tobacco control efforts. They include everything from monitoring to raising taxes on tobacco products and monitoring the tobacco industry, for example. So all of those combined provide guidance to countries on how to measure what's going on. That's the Empower is monitoring tobacco surveillance and policies, and then also to enact programs that allow them to tackle different, anything from legislative to monitoring of the industry, raising taxes, to protecting people from secondhand smoke in public and other places, having legislation and other efforts, and helping people to quit. Another very important aspect of, as the landscape changes, we need to have services to assure that people who want to stop can.
Dr. Ahluwalia, going forward, really, what is the bottom line about global tobacco control and monitoring?
We know surveillance is essential. Data tell us where we are, where we need to go, and what we've done well. And I think in terms of millions of lives are at stake, and we have an opportunity to save them. And in fact, 100 million lives is the goal for tobacco control. And our data will be really important to measure measure where we are, and what gets measured gets done.
Thank you very much, Dr. Ahluwalia, for your work and for being here with us today.
It's my pleasure.
Thank you for joining us for Beyond the Data.